And so we do know that there is hope, there is help, and if a person wants to get well, we can help them to understand the behaviors that they need to change. That's what we do here. We focus on changing those behaviors. Because addiction, one of the reasons why addiction has such a horrible stigma attached to it, I think, is that those behaviors, you get into that criminal justice system, you get into the manipulations, you get into the lying. That's all part of the behavioral changes that come along with a person who has an addiction problem. And so when they come here, we teach them, now you have to be honest. Now you have to stop doing those types of behaviors. Now we have to resolve some of these other issues. And when they do that and when they're committed to this, yeah, absolutely, they can recover.
I think what we've seen is that by using opiate replacement therapy, you can get to the actual chemical part of their problem, and that giving them medications like Suboxone allow addicts to function far more normally, to hold down jobs, and to go back to a regular life again, because they're not spending all of their waking moments trying to get heroin or trying to convince themselves they don't want heroin now.
And I ended up finding a Suboxone clinic that accepted insurance and actually wanted to help. It's a very strict program, and it helped save me. It helped get me back on the right track. I don't plan on staying on Suboxone for the rest of my life. And if it wouldn't have been there, I don't know where I would be.
But unfortunately, it's just such an overwhelming desire. It's an illness and it needs to be treated. And for many people, it requires medication. And so if you're thinking about having a methadone clinic in your neighborhood or have patients in Suboxone, the studies have shown that they both decrease crime, that patients are having jobs, they're back in society, as opposed to spending all their time trying to steal from stores and get money to use for illegal purposes.
I think we need to educate our people, parents and children, both, of what this drug can do. Education is the biggest thing, because believe me, it can happen to anybody.
And so what we chose to do is, from United Way's standpoint, is chose to try to stop it from happening in the first place, which is prevention. We researched the #1 rated evidence-based program across the United States, which is called Botfin Life Skills. That program, delivered with fidelity to our middle school students, will definitely reduce the risky behaviors, reduce drug and alcohol abuse in their future. So what we've chose to do is partner with a lot of organizations around the community, our drug and alcohol units, school districts, other providers of programming, to have Botfin Life Skills implemented in all of our school districts. And I'm really happy to say that as of this year coming, Botfin is going to be in every one of our 24 school districts in Cambria and Somerset County, a true success story.
I always say, older brothers or sisters, sit down and talk to your little brothers and sisters and tell them, why did you not get on drugs? What steered you away from them? Why did you not do it? So I think in the prevention end, if we can get some kids, at different age levels to stand up and say, I'm not doing drugs and here's why, that would influence other kids to follow them.
We are in the process of building a very large coalition to address the drug epidemic in our community.
The idea behind community coalitions or collaborative work is that together we can accomplish so much more than if we were working as entities or as individuals.
And the only way we're going to do that is for everyone to be at the table, from community leaders to businesses to healthcare providers to the legal community, law enforcement, our victim providers, our treatment providers, people who are actually doing the rehab. I think we can all educate each other and we can all work together to get a better solution in place.
When you bring a lot of people, passionate people together, there's definitely going to be positive things happening for our community. This issue cannot be handled by a small group. It has to be handled by a community as a whole. I see a lot of hope in the future because we're working more together around this critical issue.
Fortunately now that we have so many individuals paying a lot more attention to this, I certainly think that the future will hopefully be brighter, and most importantly, we need to be able to provide the support for these individuals that need help.
We know that even one life is one life worth paying attention to and investing our time and energy, and we will definitely do that. But in addition to that, the Cambria County statistics show that there's been an overall decrease from 2011 to 2015 in prescription drug use, and prescription drug use then leading to opiate use. So this is promising in that most youth, more than 95% of the students, are making healthy, good choices.